Well, good morning, everyone. I think we'll get started right on time since we do have a full agenda and hopefully we will have questions at the end. We're very excited to have you on this call today, and it's great that we have such wonderful participation. A special thank you to our legislators and staff who've joined us today. And also a shout out to our community partners from around the state who are participating as well. We're really thrilled to be with you today. And lastly, a special appreciation to my team for pulling off this event today and for all the amazing work they do every day. So let's get rolling on the agenda. I do want to point out that there is a Q&A chat box. So please, throughout the discussion, if you have questions, put those in the Q&A chat box and we will tackle those at the end. If for some reason we don't have time to get to all of them, we will get back to you after the event. So we do promise to answer any questions that you have to the best of our ability. So I am Stephanie Rubin. I'm the CEO of Texans Care for Children. Our goal at Texans Care for Children is that each and every Texas child will be safe, healthy, ready to learn, and on a path to fulfill his or her promise. So to achieve that goal, we will need smart policy changes and investments now and into the future. As you know, we work on a range of policy issues. We'll be talking about those today that affect kids and families, including early childhood, child welfare, child health and mental health, and youth justice. We also work very hard to address these issues in a cohesive way. We do know, of course, that kids and families aren't just touched by one system. For the most part, they're touched by all the systems. And so we talk a lot about how these systems intersect in a positive or in ways that can be improved to better serve kids and families. So for example, we know that for kids to be successful in school, it's not just about what happens in the classroom. It's also about what's happening in their homes and in their communities. And so that's why we're trying to approach these issues in a very cohesive way. So we are very hopeful in the fact that we're talking about the budget aspects of these issues today. We are hopeful that this is an ongoing dialogue with all of you about the budget, a discussion that obviously started last year and will continue throughout the legislative session and beyond. So we recognize that the budget is a process, that right now we have first drafts from the House and the Senate, and we want to be helpful resources to all of you throughout this process. For today, first we will have members of our incredible policy staff speak to some of the key budget takeaways related to education, specifically pre-K investments for our youngest Texans and student mental health supports. Then we'll walk through good investments and our concerns in areas of child welfare, health, and early childhood intervention. Of course, we acknowledge that these aren't the only important issues facing kids and families, but these are some critical ones, and that's what we'll focus on today. So again, as a reminder, the Q&A box is for your questions along the way. So please feel free to just add those in and we will tackle them. So I'm going to start with some key takeaways from the budget. I will say at the outset that, to make sure the budget process produces the best outcomes for Texans is to ensure that the Finance Committee and Appropriation Committee offer everyone who would normally testify on the budget during a typical session an invitation to testify virtually and safely this session. It's so important to hear about the impact of potential budget decisions on Texans from their own mouths, not just from words on a page. We do know the difference that the testimony in person or virtual testimony where you can see and hear a person just has a really different impact than written submissions. We do appreciate all the hard work that Lieutenant Governor Patrick, Speaker Phelan, Chair Nelson, and Chair Capriglione and their staff, as well as the LBB, have put into the first drafts of the budget. We know they're working really hard under difficult circumstances. We particularly appreciate that they largely wrote this budget bill in a way that recognized that right now, in the middle of this pandemic, would be the worst time imaginable to cut education, healthcare, and other investments. I think they recognize that kids and families are hurting. Students are going to need help catching up in school. Services for mental health and child abuse prevention are in demand like never before. Families have lost health insurance as they've lost their jobs. And everyone from our schools to early childhood intervention providers have taken on new costs as they've tried to keep serving Texans in a safe way during the pandemic. Before we start talking about what's in the budget or thus far missing from the budget, I just want to note that the proposed budgets are higher than the comptroller's revenue estimates. We encourage the legislature to close that gap by using the COVID relief funds and rainy day fund, part of which will also be used for the supplemental budget bill. They can also close that gap by using some of their usual budget maneuvers, like delaying a payment to the Foundation School Program, so it falls at the beginning of the next biennium. And we think that developing a Texas plan to take those Medicaid expansion dollars would also help fill in the gap between the budget and the revenue estimate. So a couple of key takeaways from the budget, and then I will hand it over to our policy staff. But this is a little preview. So we're glad to see that HB3 appears fully funded and the commitments to maintain public education and pre-K funding are there. But COVID demands additional action. Also, while millions of students in Texas have likely experienced feelings of anxiety, loss, and isolation, the TEA-based budget includes no funding for schools to address learning loss that's rooted in the emotional distress and challenges that students have faced. Early childhood intervention, something we've talked about quite a bit, is a highly effective federal state program for infants and toddlers with disabilities and delays. But years of underfunding at the state level has led to an under-enrollment of eligible infants and toddlers in the program. We are concerned that the low level of funding in the House version of the budget and SB1 will make it very difficult for programs to serve eligible kids. Investments in foster care system and the child abuse prevention programs are level funded and on the right track, but state leaders need to prepare for the Family First Prevention Services Act, and we'll talk a little bit more about that today. Finally, as the national conversation about racism continues, and as COVID-19 disproportionately harms people of color due to longstanding health disparities, jobs that can't be done safely from home, and more, now is the time for state action to address racial disparities facing Texas kids. An important step for Texas is reinstating the Office of Minority Health Statistics and Engagement, which the state defunded and eliminated in 2017. So now I will turn it over to David Fagan, our Early Childhood Policy Associate, to start with a closer look at Article 3.
Okay, thank you, Stephanie, and good morning, everyone. Really grateful for y'all taking the time to join us today. As Stephanie said, I am David Fagan. I'm the Early Childhood Policy Associate here at Texans Care for Children, and I'll be kicking off some of our more detailed discussion on education funding in Article 3. Just a reminder, keep putting in your questions in the Q&A. We'll address them at the end. And yeah, I'm happy to talk about early childhood education and how it's funded in the state budget. So if we go on to the next slide. So just some of our top 3 takeaways. I'll start by talking about the good news a little bit more that Stephanie touched on. HB3 is fully funded in the House and Senate budgets, and we don't want to take that for granted. We have a consensus among the chambers that, as Stephanie said, this would be the worst time to stop the progress that we made on HB3. But unfortunately, we do have to talk about some of the ways that the COVID-19 pandemic changed the context and disrupted young children's access to effective learning opportunities, and talk about some ways that we can address that within our state budget. So on to the next slide. So again, HB3 is fully funded. Last session, many of you will recall that lawmakers really recognized the research from Texas and across the US that shows that effective pre-K programs, they help students start kindergarten with the skills they need. It boosts school literacy and academic achievement. And HB3 cuts are currently not on the table I provided some of the specifics here. All these numbers are really just there to tell you that it is true, it is in both budgets, and we're very encouraged by that. And so with this funding commitment, we're able to really ensure that the early education allotment, which we fought so hard for last session, along with so many great partners that supports full day pre-K and other early learning strategies, is completely supported. Of course, it's worth remembering that the education committees will be working on an HB3 cleanup bill. So we'll be monitoring that to see how it might change any of the formulas or allocations. But so far, so good on HB3. Big credit to the Lieutenant Governor, the Speaker, the Governor, and everyone else who came together and at least provided us this guarantee that HB3 will be here for schools. So moving to the next slide, I'm going to talk a little bit more in detail about some of the areas I think we can improve the budgets. So the COVID exceptional item that TEA requested is incredibly important in light of the learning loss we faced and the ways it has disproportionately impacted low-income children, children of color, English learners, and it really demands our attention. So they requested an exceptional item called ensuring equitable opportunity through targeted supports. And basically what that means is high quality instructional materials, the recruitment of diverse educators, and targeted outreach and interventions for students most at risk of learning loss. It's $20 million over the biennium. We're really hopeful that with more information and discussion among leadership, we will see this funded. We have many different funding sources to make it happen, as Stephanie alluded. And this is just incredibly important to make sure that the vision of HB3 is realized. The funding that was guaranteed in the budget is important and essential, but unless we address the completely changed context in light of COVID-19, the goals and vision of HB3 won't be realized. And if you go to the next slide, I'll talk about another deep concern of ours around making sure that the HB3 vision is realized, and that's around the COVID enrollment declines and the funding that supports average daily attendance. So many of you understand that Texas districts fund based largely on average daily attendance, and because COVID-19 has led to significant drops in attendance and enrollment, funding protections have been put in place last year to ensure that districts don't lose funding when they needed it most. So that was great. It was important when the pandemic was first hitting and we were all sort of sheltered in place. Districts were not losing money because kids were not at school. But unfortunately, no protections have been issued for the spring semester, which is happening right now. And this is a statewide problem. It affects all grade levels, but as you can see from the slide, this is particularly a challenge for early childhood education. It's particularly a challenge for pre-K. We have a 22% drop happening right now in pre-K enrollment. And we know that's due to the fact that families are concerned about exposing their children to the virus. Districts are unable to conduct their typical outreach due to COVID era restrictions, things like knocking on doors, which districts do to get pre-K enrollment up. And with all that in mind, we shouldn't expect that enrollment will return to normal until the virus itself is contained. So some of the districts who have been most aggressive in the state in advocating for their pre-K programs have seen seen enrollment declines as high as 40, 35% at points in this pandemic. So that's the bad news. This is not addressed in either of the budgets. The good news is, as Stephanie said, we have billions of dollars of federal funding that we can leverage for these purposes. We have the Rainy Day Fund and other state resources. We also have had a bipartisan coalition of legislators who've called for the extension of these protections. And at the height of this pandemic, we really should just make sure that educators are not laid off. Districts have the resources that they need to rebuild their pre-K programs, continue building on the progress from HB3. And these protections are an essential piece in making that happen. So state leaders have sort of advised that we will hear about this decision in a month or so. And we just urge everyone to keep sounding the alarm on this and making sure that HB3 is realized and our pre-K programs are able to rebuild from this unprecedented crisis. So if you go to the next slide, I will just touch on a few other things that I'm happy to talk a little bit more in depth about during Q&A if folks would like to hear more. this is a briefing about the budget and the big budget numbers, but one of the other great successes of HB3 was that it established high quality standards in our early childhood education system. Things like making sure that educators are trained in the science of reading, and so much more, trying to encourage and incentivize class sizes that are manageable for teachers. These are things that we want to keep talking about. We don't want to wait another session before having the important conversations around how early childhood education is funded and supported. And so, we want to see action on that this session as well. Also, we want to make sure that through our policy decisions and our funding decisions, we're supporting the children most adversely impacted by learning loss, most impacted by COVID-19. And that includes our young English learners. We published a policy roadmap on bilingualtexas.org that I encourage you to check out. And it really speaks to the ways that we can ensure that educators are supported, that we're building the workforce that we need, and that young English learners from childcare through pre-K through the early elementary grades have access to high quality services, especially now when they've seen disproportionate learning loss. And finally, we have to make sure that our childcare programs, those essential workers who stepped up to take care of these other essential workers in our economy, during the height of this pandemic, are supported. So we want to see increased action on high quality childcare programs. We have federal funding coming down to Texas, over $1 billion to support the childcare industry. So we're very engaged in those conversations, and we hope the legislature will be as well, to ensure that our high quality childcare programs are supported through this pandemic and beyond. So that's what I have. With that, we're going to stick on Article 3, and I'm going to turn things over to my colleague, Josette Saxton, who's going to talk a little bit about student mental health and what we can do in the state budget.
Great, thank you so much, David. Good morning, everybody. I'm Josette Saxton. I'm the Director of Mental Health Policy at Texans Care for Children. So I think we all know that the COVID-19 pandemic has created new challenges and exacerbated old ones for children in every part of the state. Between adjusting to remote learning, to having their relationships and their activities disrupted, and then also realizing that many families are really struggling to put food on the table, keep a roof over their heads with job loss and lower income coming in. All of that on top of the very real sort of threat the virus is having on kids, parents, their grandparents getting sick or even dying. So all of these things are probably they are normal reactions for kids to then for experiencing worry, stress, anxiety, grief, and depression. Again, these are all normal responses to the challenges that we're all facing. But that doesn't mean that they're not going to affect children's well-being and their education. So while our legislature, we know, is going to be doing a lot of good, thoughtful work and discussion this session to see how our schools, how our legislature can help schools to address the learning loss that has occurred from things like remote learning and challenges related to technology. Addressing the pandemic's response on learning loss also needs to include addressing the social and emotional effects of learning have on our student learning. Mental health is inextricably tied to a student's ability to learn. And so this is why it really needs to be a conversation as we're looking at supporting schools and students. So if we can go on to the next slide and just take a look at what our budget, how the budget proposals stand to address these social emotional effects of the pandemic on learning. And unfortunately, both of the introduced budgets in the Senate and in the House don't have any funding that would target schools being able to address the social emotional impacts. Also wanted to note that the exceptional item that TEA has requested to address learning loss does also not include addressing the social emotional barriers to learning. And we're really looking forward to conversations over the next few weeks and months to make sure that there is some support that's going to schools on how they can address students' mental health. While some students, that will mean connecting them with mental health professionals who can provide them with clinical services that we tend to think about when we're talking about student mental health. We also need to recognize that there's a lot of things that schools can do in the way they set up the school day, the way individual or adults in the school are interacting with kids, policies that they have in place about how schools are running, all play a part in supporting how safe and supported schools feel while they're at school, that we know is just so critical to help kids get over the distress that they're feeling because of the pandemic. And again, these are all things that are important that don't involve actual mental health treatment, which is something that we leave to the mental health sort of experts. But again, knowing that schools can do things within their classrooms, be it virtual or remote. So if we can go to the next slide. And I also just wanted to highlight too that there was a recent study that came out from Raise Your Hand Texas, where they polled, representative example of Texans just a few months ago, was asking them some questions about how they feel about the state of learning, and also included questions about the effects of the pandemic on their students on their kids and what they're experiencing. And again, coming from parents of public school students, the social emotional aspects of their students was something that was a priority for them, where you can see the responses where the majority of respondents said that it's extremely or very important for schools to provide not only interventions related to supporting student mental health, but also teachers' emotional health. Because I think we all know that the way, how well a teacher is doing is also going to affect how they are going to be able to be there to support their students. And again, families were reporting that lack of these social supports in schools and mental health supports in schools was a barrier to their students being able to learn. So this is something that Texans and parents think that schools need to be addressing. So the next slide. So again, knowing that there's a lot of challenges that our state faces, but then also, in terms of, priorities that need to be addressed, but there's also a lot of opportunities for our state to help support schools. So one of the things that I would love for our legislative leaders and our budget writers to know is that, remember, you can use both existing and future federal COVID relief dollars to help schools address student social emotional wellness. One example that already happened was TEA being able to use some of the CARES funding to develop some online trauma-informed care training video series for educators for free across the state. And so again, this is a great way where I think these type of efforts are things that we can do at the state level that can help all schools be able to address the students in their classrooms. And we also know that there's at least 10 other states that have used the first round of CARES funding to address students' social emotional development or their mental health. So this is something that Texas can do to help support students and schools. The next slide, please. And so what are some specific things I think that the way our legislature can help schools address students' social emotional wellness and mental health? One is recognizing that the last session in 2019, the legislature passed a lot of really good legislation on how schools can address student mental health, as well as school-wide strategies to create safe and supportive school climates that we know are good for all students in terms of improving their academic outcomes, but really important too for those kids that are struggling with mental health concerns or other challenges that are in their life that make it difficult for them to really engage in their schoolwork. And so while the legislation passed last session, there really wasn't much, if any, funding that was provided to districts to help them actually implement those provisions. There was a little bit of funding that was available available through the safe and school safety allotment that was provided in SB 11. But it was something that districts could use to address mental health sort of strategies in schools, but they could also use it to address physical sort of safety things like cameras, emergency operation plans, more of that we think of like hardened activities. So again, while schools were provided with some funding through the school safety allotment during the last biennium, while there's little, if any, information on how schools use it, word on the streets is many of it did not go to the mental health services and supports. So another recommendation is to continue funding the school safety allotment that was created in SB 11, but then also making sure that there is funding there that is directly going to help schools address student mental health and school-wide strategies that create safe and supportive school climates. Another idea of, that the legislature should be looking at is providing mental health infrastructure grants to schools. Now, this is a strategy that the legislature took last session to help schools really start to develop some more of school safety needs that they had following the tragedy at Santa Fe High School. And these were school safety infrastructure grants, but again, that did not include mental health type of strategies. And $100 million went to schools last session in the budget to address some of these school hardening activities. And so I think this year, given the widespread impact that the pandemic is having on students' social, emotional well-being and their mental health, and then also even recognizing their teachers and their other school staff, we really need to be building up schools' ability to address not only the mental health of their students and their teachers, but again, also looking at those school-wide strategies. And again, a lot of schools are already doing these kind of things, but a lot of schools aren't. And so for everyone, it's really important that the state provides or makes sure that there's technical assistance and training available so that schools that are wanting to improve the way they're addressing student mental health, their social emotional wellness, are they trauma informed, that they have places where they can go to learn how to best address their to identify what are the specific needs of their campus, of their district, and how can they set up a plan with the resources that they have to better to meet those needs. And so again, there's I think opportunities for the state legislature to support some statewide training and technical assistance that schools can access. So the next slide, please. Oh, one other thing I want to mention, even though we're talking about, I think, TEA's budget primarily, both David and myself, I wanted to also point folks to the Texas Higher Education Coordinating Budget, Board's budget. Inside there is funding for the Texas Child Mental Health Consortium, and this was something that was also created in SB 11 last session, that was really looking at tapping into our institutes of higher education, our departments of psychiatry within our medical schools and health centers across the state to help address the need of mental health treatment for students who need treatment. And it's more focused on providing treatment, usually in a community setting, but within the consortium, they have what is referred to as the TCHAT program, which, and forgive me, I don't recall the acronym at this point off the top of my tongue, but what this does is it's a project where our medical schools and our health science centers are providing telehealth services in a school to students to help to provide some mental health services to those students who might not otherwise have access. And so we were very pleased to see that the Senate increased funding for this program by almost $15 million over the biennium. This is something that is not included in the House budget, but we're hopeful that it will be included in the final budget that passes, because this is really an innovative way to help address the mental health sort of treatment or clinical needs by bringing some services into schools so that, again, really through the goal of really making sure that our students are head ready and well, so that they can focus on learning and be engaged. And so we can avoid the learning loss that we know is occurring, not just because kids aren't actually in school and are learning remotely, but because of these underlying social emotional needs. And so finally, I just wanted to say, and actually what I wanted to do now is we're going to kick it over to my colleague, Kate Murphy. I wanted to mention that as I'm talking about challenges kids are facing in schools and socially, emotionally, recognizing that kids in foster care are especially at risk. And so now Kate Murphy is going to be introducing some items in the Article 2 budget that can help support kids. And she's going to start us off by looking at foster care. So Kate, the floor is yours.
Thanks, Josette. Good morning, y'all. I'm Kate Murphy, the Senior Child Welfare Policy Associate at Texans Care for Children. If you joined late, we are wrapping up our discussion of Article 3 and diving into issues affecting health and welfare, child health and welfare in Article 2 of the Texas budget. And I just want to remind y'all that if you have a question, please put it in the Q&A box and we will address those at the end. So let's get started with child protection. Next slide. Our main goals this session are to keep more children safely with their families and out of foster care, and ensure that when children do enter foster care, each child has a safe, nurturing home to go to where they can heal from trauma that they've experienced and thrive. Next. Today, I'm going to walk you through the good, the bad, and the uncertain regarding child protection in the Texas budget. As Stephanie mentioned, DFPS is starting from level funding. We appreciate state leaders maintaining investment in child protective services and programs that prevent child abuse and neglect. Although DFPS is not experiencing significant cuts, DISHES is another story, and one of the programs that is swept up in the 50% cuts to their budget is MedCares, which funds programs that serve children who may have experienced abuse. One thing that continues to be uncertain in the Texas budget is what Texas is going to do about the 2018 Family First Act. For those of you who are unfamiliar, Family First restructured how the federal government funds state child welfare systems. And there are two big questions that the legislature has not accounted for in preparing the base budget. And the first is, will Texas take advantage of new federal dollars to prevent kids from entering care? This funding could support evidence-based substance use and mental health services, as well as parenting support services. And the second question is, how will Texas address the anticipated $52 million loss in federal foster care funding resulting from the state not meeting new federal standards for foster care facilities? So let's dig a little deeper into the good. Next slide. Preventing child abuse is good. When families experience stress, as they have been during the pandemic and recession, we know that risk factors for child abuse and neglect or CPS involvement often increase. For example, during the first few months of the pandemic, domestic violence related murders more than doubled in Harris County. Families with tight financial resources have been under additional strain, and challenges associated with poverty, like housing instability, can increase the likelihood of CPS involvement. Texas mental health experts expect to see increased rates of mental illness and substance use disorders. And some reports suggest that sexual or physical abuse has increased or worsened during the pandemic. For example, in April of last year, for the first time ever, half of the victims receiving help from the National Sexual Assault Hotline were minors. And Cook Children's Hospital in Fort Worth has reported a spike in the number of severe or deadly child abuse cases that it's seeing. One meaningful way to keep kids out of foster care and safely with their families is to invest in child abuse and neglect prevention services. We know that this makes a difference. Following cuts to the child abuse and prevention budget in 2004 and 2005, we saw a 20% increase in confirmed child abuse victims. And then again, after the Great Recession began in 2008, we saw a 44% increase over the next few years. Increasing investment in prevention and early intervention, or PEI programs, is our best hope for avoiding another possible spike in abuse. We also hope the legislature will take advantage of new federal funding opportunities for prevention services under the Family First Act. DFPS proposed several strategies for how to use this new federal funding, and we believe state leaders should prioritize the three that I have outlined on this slide that build on the excellent work that PEI has been doing in communities around Texas. Now let's look a little bit more at the bad. Next slide. Losing the MedCares program is one of our biggest concerns when it comes to child protection. Senator Nelson and then Senator, now Lieutenant Governor Dan Patrick, started this program after seeing the spike in abuse and child deaths during the Great Recession. MedCares provides funding for sexual assault nurse examiners, social workers in hospitals, researchers, and child abuse pediatricians. MedCare's funded programs have two functions. They work to prevent child abuse and neglect in their communities, and they help correctly evaluate allegations of abuse or neglect. The professionals in these programs don't determine whether abuse or neglect occurred on their own. They report findings to CPS, who will present their assessment to a judge, and then the judge will make an ultimate decision about whether a child is safe or CPS needs to remove the child from an unsafe situation. Child abuse pediatricians are highly trained physicians who treat children and adolescents with suspected child abuse and neglect injuries. And research shows that child abuse pediatricians are more likely to correctly diagnose abuse and neglect than less specialized physicians looking at the same injuries. Cutting MedCare's funding would tear down critical infrastructure Texas has to protect children. And again, I just want to thank Senator Nelson and Lieutenant Governor Patrick for starting the MedCares program back in 2009, and we look forward to working to try to protect it. And now let's tackle the uncertain. Next slide. We've spoken a little bit about Family First, but I also want to talk about addressing the anticipated loss of federal funding. We know that safe, nurturing connections are critical for child development. Some research has also suggested that children being in foster care, especially for long periods, can cause harm. Because of this research and the strong desire to keep more families safely together, the feds decided to open up funding for prevention services by restricting funding for foster care facilities. Federal funds can continue to support family-based foster care and high-quality or specialized providers that serve larger groups of children, but these new restrictions, which take effect in October of this year, are expected to cost Texas about $52 million over the next biennium. Complicating this issue, before the pandemic, we knew that Texas lacked foster homes willing to serve teens, children with high needs, and kids in rural communities. The pandemic has only made things worse, and Texas also faces urgent and well-documented challenges that demonstrate that some children in foster care are unsafe and unsupported. These safety issues have come up the most frequently in these larger foster care facilities. So we have two budget strategies that we are promoting to ensure that more kids in foster care get the support they need. The first is expanding age eligibility for treatment foster family care. Treatment foster family care is a family-based alternative to residential treatment centers. For the same cost, it gives kids a chance to be with a highly trained family and not in an institution. Texas is already a leader in offering treatment foster family care to little kids with high needs, but right now it's only available to teens and tweens in community-based care regions. And it's important for this option to be available to older youth statewide. Our second strategy is to allow foster care providers to offer discharge planning and aftercare services. Many of our kids with high needs currently receive services and supports through foster care facilities called residential treatment centers, or RTCs. These services help children successfully transition out of this highly structured institutional setting. And some of the goals are to decrease readmissions to RTCs, to improve family relationships and home stability, and to help kids succeed in school and other community settings. RTCs must offer discharge planning and aftercare services to continue to be eligible for federal reimbursement, and currently 0 providers in Texas offer these services. CPS performs this function. So this is a barrier to protecting federal funding for foster care. Next slide. I know this has been kind of a lot, but I have a few other things to note. It's worth highlighting that the most significant difference between the House and Senate-based budget bills related to child welfare is funding for community-based care, which is the ongoing effort to shift the child welfare system's management to local community organizations. The House budget pauses implementation of community-based care where it is, and the Senate provides funding for projected growth in the 4 areas where community-based care expansion has already started. This does not include the DFPS exceptional item to expand community-based care into 4 new regions. One thing that isn't included in the proposed budget is costs related to the ongoing federal lawsuit. A federal judge has found that Texas has unconstitutionally harmed many children in our foster care system, and there are costs for court monitors and implementation of court orders. DFPS and HHSC have asked for a combined total of over $70 million to help cover compliance costs. And I want to note that foster care providers have struggled quite a lot during the pandemic. And so there will probably be a bigger conversation about whether we need to adjust the state's payment rates to our foster care providers. With that, let's just remember that our foster care system's 2 main goals should be: 1, to keep kids safe with their families, if at all possible, and 2, if CPS needs to take custody of a child and place them in foster care, that child's temporary living arrangement should help them heal and thrive. We want the Texas budget this year and every session to reflect those goals. And now I'm going to turn it over to Katie and Adriana to talk about child and maternal health.
Thanks so much, Kate. Hi, I'm Katie Minton. I'm the Health Policy Associate. I'm excited to talk to you today about some of our key takeaways around how the base budgets look for children's health. So this slide shows the top 4 takeaways, and just a quick overview. There are several assumptions that are made in the Medicaid and CHIP budget, which is understandable with such a huge budget that Texas has, but I'm going to flag a few assumptions for you all to keep in mind. Second, the House and Senate proposed cuts to HHSC eligibility and enrollment, which could lead to delays and could be very bad for families that need to access these services. And that also the House budget maintains the per child funding levels for ECI, or early childhood intervention, but the Senate budget is too low for ECI, and we have some concerns over that. And then I'll pass it over to our policy director, Adriana Kohler, to talk about funding for Department of State Health Services, or DSHS, maternal mortality prevention efforts, and she'll provide us with some closing thoughts around the health budget as well. So before we jump into talking about Medicaid and CHIP budget, you may be wondering why funding for Medicaid and CHIP is important, or you may not be wondering since we're in the midst of a pandemic. But if you are wondering, well over 3 million children get their health coverage through Medicaid and CHIP, and over 100,000 births are covered by Medicaid each year in Texas. Medicaid improves outcomes for kids. Children on Medicaid have better attendance in school. They have higher educational achievement, decreased dropout rates from high school, improved long-term health, fewer chronic conditions, fewer hospitalizations and ER visits, better long-term economic gains. There's research that shows that women with Medicaid as children had higher wage incomes as young adults. So We understand that budget writers had to make a lot of assumptions, and with COVID, there's even more unknowns, but we wanted to draw your attention to 3 assumptions made in the Medicaid budget, both in the House and the Senate. The first one is that there's a less favorable FMAP. This is the federal medical assistance percentage. These are the rates used to determine the federal matching rates for states. It's different for each state. So for fiscal year 2022 and 2023, Texas has a higher per capita income when compared to other states. So we get a lower FMAP. This means fewer federal funds, and we have to make that up with general revenue. The second assumption is that separate from regular FMAP, the base budgets assume loss of the 6.2 percentage point increase in FMAP that Texas is currently getting as part of the Federal Family First Coronavirus Response Act. The loss in this bump when the public health emergency ends will result in a lower proportion of the Medicaid funds coming from the federal funds. However, it's very likely that we will have this 6.2 FMAP bump at least for the first several months of fiscal year 2022. This may impact the LBB projections throughout session. Recently, the Biden administration sent a letter to governors, actually just earlier this week, assuring them that the public health emergency and the FMAP bump will continue through March 2022 at least. So what does this mean? It means that we may have more federal money for Medicaid than what the base budgets assume. And the third assumption is that the budgets do not include full funding for anticipated increases in cost. These costs could increase due to medical inflation, higher utilization, or an increased need for levels of care. This was the exceptional item number 1 in HHSC's LAR, but it was not included in either base budget. We really need to fully fund Medicaid and provide funds for caseload growth and growth in health costs to make sure that we have enough providers across the state that are willing to participate in Medicaid and CHIP. Next slide. Thank you. So the second thing I wanted to touch on is that both base budgets cut funding for eligibility determination and enrollment. This funding ensures that the state is able to process applications for programs like CHIP, Medicaid, SNAP, or food stamps, and WIC in a timely manner. These cuts are actually a continuation of HHSC's 5% reduction plan in the current fiscal year, in the current biennium. When the agency proposed cuts in 2020, they actually said that families would face delays if they attempt to sign up for services. They noted that the proposed cuts could result in increasing the agency's risk of not meeting federally required eligibility determinations, target, and timelines. So what this means for Texas families is that it'll make it harder and slower for them to sign up for SNAP, CHIP, Medicaid, and other services that they need during the recession and public health crisis and services that they need beyond. We need to reinstate these funds for eligibility and enrollment because as our economy recovers from COVID-19, families will continue to need access to these services that are critical to their health. And finally, before I pass it over to Adriana, I want to talk about early childhood intervention. As Stephanie mentioned in her introduction, early childhood intervention is a highly effective federal state program for infants and toddlers with disabilities and delays. Serving kids during the first 3 years of life, a critical time of brain development, provides a great return on investment. ECI helps infants and toddlers with disabilities and delays learn to walk, communicate with their families, and get ready to start school. ECI reduces the need for special education, saving the state lots of money. But years of underfunding have led to the state under-enrolling eligible infants and toddlers. In fact, in October, a report came down from the federal government that found that Texas was not meeting its obligation to serve all eligible infants and toddlers. And Texas is actually currently required to develop a plan to address the fact that we're not serving all eligible babies and toddlers through this critical program. So, sorry, can you go back one slide? This slide actually shows the proposed appropriations for ECI without accounting for the number of kids who are estimated to be eligible for ECI or the higher cost of ECI providers are facing due to the pandemic. You can see that the Senate proposal is too low, and this is particularly concerning. And I'll talk a little bit more about it in the next slide. So this graph shows the amount of funding per child per month that has been allocated by the legislature for a little over a decade. As you can see, ECI funding has been cut year after year up until last session. Since 2010, 18 contractors left the program, often citing funding challenges, including repeated years of financial loss incurred by delivering ECI services. We now only have 41 ECI providers serving all 254 counties in Texas. As the graph shows, last session, the legislature took a positive step and increased the per child funding slightly. The House proposal maintains this funding for ECI, and it also has realistic projections for the number of children the program will serve. However, the Senate-based budget cuts funding and proposes serving far too few children. This graph shows that the per child amounts for both the House and the Senate using the realistic enrollment projections provided by the House. As you can see, the Senate appropriations set us on a path to continue to underfund the program and ultimately underserve infants and toddlers. In order to provide comprehensive services for infants and toddlers with developmental delays and disabilities, we really need to fully fund ECI. Building on the positive steps of last session, we should increase the per child funding amount to $450, which was the average over the last decade. And now with that, I will pass it over to Adriana Kohler to talk about maternal health.
Great, thank you so much, Katie. Can you hear me? Great. Good morning, my name is Adriana Kohler. I'm Policy Director at Texans Care for Children. I will wrap us up with just some additional points around maternal health. Keep your questions coming in. We will answer them shortly. And for those that have been wondering, slides will be made available and we're recording, so the recording will be made available. Katie shared some important points around the budget related to child health. I'm going to talk a little bit about specific budget areas that are key for maternal health. We know that healthy pregnancies, healthy births, and healthy parents are a foundation for healthy kids. A mom's physical and mental health during and after her pregnancy play a big role in her own long-term health and her baby's health and development. For example, if a mom has a pregnancy complication that crops up, this can lead to really scary hospital visits, emergency surgeries, and neonatal intensive care stays, NICU stays for the baby. These are not only scary for everybody and could affect the health of mom and baby, but they add cost to the state budget, the Medicaid program, and our healthcare system overall. So it makes fiscal sense to invest in keeping moms and babies healthy. So let's take a look at the budget. There are a few areas to highlight. Rider 22 in both the House and the Senate versions continues $7 million in federal funds for maternal health initiatives. This includes funding for Texas AIM, the Maternal Health Safety Initiative. This program equips hospitals to prevent and respond to pregnancy complications, issues that crop up. This program saves lives, reduces costs, reduces needed NICU stays or surgeries for moms. Really important program. The funding also supports the DSHS risk assessment tool that helps doctors and community health workers and others identify pregnant women who might be at higher risk of a complication or a bad birth outcome. This funding is really important. Last biennium, these initiatives were funded through GR, 7 million in GR. Now Rider 22 uses federal funds to maintain maternal health initiatives. This funding was taken from Title V federal funds and was taken from the MedCares program. Kate earlier talked about the MedCares program. This is a child abuse prevention program that has been eliminated. So we support the funding in Rider 22 for maternal health, but disappointed and concerned that it comes from another area of the budget and may lead to defunding of MedCares. Next slide, please. Just some additional key points. There is a cost containment rider in the Senate bill, SB1. This is simply a huge cut to Medicaid. I cannot say that enough. It is a cut. We are glad that the cost containment rider is not in the House version. And we want to make sure that that cost containment rider does not lead to a huge cut to the Medicaid program. Rider 23 in the House version is a great strategy. It aims to improve access to pediatric services for children age 3 and younger. We've seen during the COVID pandemic, well-child visits have gone down. There's been a drop during this time in immunizations. We need to make sure we promote those well-child visits, especially for the little ones who need to come in more frequently and get those immunizations. This rider is a really good strategy to get there. It improves access to pediatric services by improving Medicaid rates for physician services for these little kids under age 3. Finally, Rider 17 in both the Senate and the House version promote maternal health through a Medicaid add-on payment for labor and delivery services at rural hospitals. You may have seen in the media, many rural hospitals are suffering. Some are shutting down their labor and delivery units. This rider and this funding helps keep rural health access up, keeps labor and delivery units open to serve new moms. Really great strategy. Next slide, please. Finally, I'll just conclude with an important policy option that would help our state budget. Texas has the worst uninsured rate in the country for both adults and for children. Many Texans don't understand how unattainable health coverage is for low-income Texans today. Texas Medicaid is currently limited mostly to children, pregnant women, people with disabilities, and low-income seniors. Under federal law, the federal government pays 90% of the cost if states offer health insurance to low-income and low-wage adults. Texas is one of the remaining states that has not accepted this funding. So as a result, what are we talking about here? We're talking about uninsured childcare educators, grocery store cashiers, other essential workers who are under the poverty line. They don't have access to Medicaid or other affordable healthcare options. They don't earn enough to get discounted health insurance off of healthcare.gov, and yet they earn too much. They don't get health insurance through their job and don't and make too much to qualify for Medicaid. So this means a family of 3 making less than $22,000 has virtually 0 options for health coverage. That leads to skipped medical care, more ER visits, even medical debt and bankruptcy. We've got a solution. There are a Texas plan that leverages those 90% federal match dollars and provides health coverage makes sense for our budget. I've noted here on the slide 2 recent studies. One 2020 analysis commissioned by Episcopal Health Foundation shows that accepting those Medicaid expansion 90% federal funds would help our state budget. The cost, that 10% non-federal share would be fully covered by the savings and the new revenue that coverage expansion generates for the state government, with extra savings left over. There's a net state budget savings of about $100 million over the biennium, over each biennium. So this is a really important policy solution to look at. It's also really popular. A new University of Houston Hobby School poll that came out just the other day shows that almost 70% of Texans are in favor of accepting these federal funds, that 90% match, for a coverage solution. So we've talked about a lot. I hope this gives you an idea of some areas, priorities, and some challenges and concerns that we have as advocates for children in the budget. We'd love to hear from you. I know we have several questions that have come in. So for the Q&A, I'm going to pass it back to Stephanie to lead us off.
Great, thank you. Thanks. I'm going to focus on the ones that are specifically around the budget. And if we have time, we can get to others, although we can also answer some in a written form, or folks can get back to you. A couple of people had questions about the availability of this information, this presentation. So there will be a link that is sent out because it is being recorded, and the slides will also be available, and we will share them to those who have registered. I think let's take one question that's a really good one that David did not go into depth on the early childhood piece, which is we are anticipating from the last COVID relief package that passed before the end of the year that Texas may get around $1 billion to support our childcare programs. And so there was a question about, David, how that funding would be used. Does it pass through the budget, or how is that distributed? And is it only available to programs in our subsidy system or other licensed childcare programs? So you could take that quickly, David, and then we can also follow up with folks with more detail.
Yeah, I appreciate the question because when it comes to childcare, this is an unprecedented opportunity for us to support our system. And I know there's a question there about whether the funding will be distributed equally. And of course, we're really pushing for it to be given equitably, where we're considering things like how the programs have embraced quality, whether they serve in a childcare desert, whether they are serving medically fragile children or other at-risk populations. So we want it to be thoughtful, but what separates this package from previous ones is that it is required that both programs who participate in the subsidy system, who serve children who receive financial assistance, and those who don't need to be getting funding through the program. So this is a huge opportunity for state leaders to connect with childcare programs who they've never had contracts with, who they haven't had an existing relationship with, and hopefully get them to participate in subsidy while also providing the needed relief dollars they need.
Great, thank you, David. There was a question also about something you mentioned, Katie, a corrective action plan and some federal involvement in our ECI program. Can you just give an extra sentence to explain what the federal findings were and what we mean by a corrective action plan?
Sure. So this federal kind of investigation, federal monitoring came after several programs were leaving ECI, not wanting to participate in the ECI program anymore because mostly because the funding was too low. And so there was a federal monitoring that came down that looked at what was happening in Texas, and they found that we were failing to meet our obligation under federal law to ensure that all children under 3 with things like autism, speech delays, Down syndrome, and other disabilities, that they were all able to access ECI services. And found that we were serving too few kids, and a big reason for that, they attributed it to underfunding of the program. And so we have an opportunity this session to provide more funding to ECI to make sure that all eligible kids have access to these critical services.
Great, thank you. And again, we will be providing the slides and the recording to folks. So that will be coming. There was also a question about something I believe Adriana mentioned, the Houston poll and the Texas 2036 data. There's also survey information from Episcopal Health. We are happy to follow up with anyone who wants that information. So just let us know. And we have a couple of questions on the chat on the Q&A box, but certainly you can always ask us. And I think we probably just most recently tweeted out the Houston poll information. David, you mentioned very briefly an English learner project. We didn't talk about it in the budget context, but there was a question about whether there are budget implications for this new information, this new focus on English learners, early childhood English learners. Could you just talk for a second about that, and if there are budget implications, at least for this session?
Sure. Yeah, I appreciate the question. I am happy to say that we have around 40 recommendations on bilingualtexas.org for the legislature, for state agencies, for schools and childcare programs And so some of those are budgetary. They're things for our school finance formulas to think about moving forward. But the good news is there's a lot we can do that doesn't impact the state budget at all. Things like a state strategic plan to ensure that we're increasing the number of certified bilingual educators, the number of children who graduate school bilingual with the seal of biliteracy, and so much more. The creation of a certification in bilingual special education so that children that are special needs and English learners have personnel at their schools who are equipped to deal with their specific needs. So there's a lot more there, but the good news is I think we can get a lot done this session without actually impacting the state budget.
Great, thank you, David. There is a very good question based on something I mentioned earlier about virtual testimony and the importance of Texans being able to communicate with legislators and staff. And I hope that the legislature, both the House and the Senate, end up putting out some very clear sort of primers on how to do it and how to communicate. I do know that the League of Women Voters is thinking about putting out something like that, where we're all sort of trying to make sure we understand the House rules and the Senate rules, which differ. And there may be some flexibility by committee in terms of what the committee chair wants to do in terms of allowing virtual testimony as opposed to just submitting written testimony. So that's, we're all still trying to understand what the rules mean, and we will also try to share information so that people know how to communicate. Obviously, there will be some ability to go into the Capitol. There will be testing available, masks required. In some cases, it does sound like registration to testify may have to happen inside the building unless there are kiosks outside the building. So there are still lots of questions, and it's not only about the rules, it's just about how the chambers implement the rules. So I think, certainly feel free to ask your legislators, and we will all try to share information as we have it. Let's see, but very good question. I appreciate that. There was a question about the bills that we're tracking and supporting and opposing. We're still reviewing what's getting introduced. Of course, we will have some Twitter threads soon that are about, in particular, good bills we like. And so keep an eye on that. And then over time, we will certainly share information about good bills and ones that we have concerns about. We will certainly make sure that people have access to that information. Let's see if there are any other questions. How are we doing on time? We have a couple extra minutes. There was another question, David, I'm going to pass it back to you about waivers, that there were programs, obviously in HB3, there was a requirement for full day pre-K, but districts could seek waivers. And I know there was some information that came out about, the extent to which waivers had been granted earlier. This, of course, was sort of pre-COVID, I think. And so just a quick question about the process for learning about what's happened with waivers and where people can go to get that information.
Yeah, and thanks again for the question. I think that the biggest thing for folks to remember is that HB3 was great for many reasons. And one of them was that it helped encourage partnerships between childcare programs and school districts to provide early education. This is a model that we've seen around the country as successful. And so for districts, HB3 required full day pre-K for districts for eligible 4-year-olds. But there was a waiver process that was given for 1 year, 2 years, or 3 years. And so for districts to get that waiver, they had to say that they've solicited a partnership with a childcare program. In practice, we don't know how robust that solicitation was. Anecdotally, we've heard about really quality childcare programs that had no idea this waiver process was underway. So we've been talking to the Texas Education Agency and legislators to make sure that for the next waiver period that's coming, we have a bit more of a strict process to make sure that providers are at least aware that the postings are done in a way where they know this process is going on and they're able to engage. And there's been a lot of state efforts to try to cultivate these partnerships, and COVID put a hold on some of them. But in talking to agency leaders, I'm encouraged about what's coming this year. around a partnership summit and some other opportunities to kind of connect childcare providers and school districts. And there might be some legislation in this session to try to make partnerships a little bit easier for everybody involved in them. And happy for anyone that wants to reach out to me and talk more about that, please do.
Great, thank you, David. Let's see. We may have hit most of our questions, some of which we can get back to folks who wanted some specific advice about how to reach their legislators or get specific information to them. So those we can handle individually. Is there anything else that my team wanted to add based on any of the questions or extra things that you wanted to cover before we close? Everybody good? Okay. So I just wanted to, again, remind people that we will send out this webinar, and we are happy for you to share it so that your constituents and partners have other information available to them. We are also happy to be resources to you, and obviously we'll be trying to meet with legislators and staff virtually, touch base with them about their priorities and where we can be helpful and where we overlap. We'll be producing more summaries of budget updates and bills, of course, as we move forward. I just want to end with thanking all of you. We know this is a really difficult time, and it's also a very busy time. So we very much appreciate your time today and everything you do to support Texas kids and families. So thank you very much and have a great rest of your day.